Well, being in the hospital, it's not usually a very comfortable experience, not to mention patients miss out on the things that often make us feel best. Things like family time, home-cooked meals, our pets.
Well, thanks to Cone Health's recently launched Hospital at Home program, that doesn't have to be the case anymore. And I learned the outcomes are as good and often better than being in the hospital.
Okay, Mr. Mowry, I'm going to check your vitals, okay?
All right.
At first glance, you might miss it.
All right, let's get your blood pressure.
But Clyde Mowry, sitting in his living room in his favorite recliner, is a hospital patient.
That's why we're giving you your medicine.
Clyde is part of Cone Health's Hospital at Home program.
And all I have to do, me or him, if he's sitting here and I happen to be somewhere else, and something happened to me, all he has to do is just push a button there and he has a nurse instantly on the line.
Now in its second year, patients like Clyde receive 2 daily visits from a paramedic or EMT, more if necessary, and numerous video calls with nurses and a physician.
So we bring the equipment, the medication, and the team delivered to the patient's doorstep. So it's the same as receiving care in the hospital bed. It just happens to be the patient's own bed.
Nursing Director Alex Carrico, alongside Medical Director Dr. Stephen Newton, helped get the Hospital at Home program off the ground. Today, a staff of nearly 50 people work in the field and out of this hub at Moses Cone Hospital, giving patients around-the-clock care and monitoring just as they would inside the hospital without the added risks.
You get higher risk of hospital infections like MRSA, COVID and flu. You get weaker while you're in the hospital, and there's also risk of confusion. So being in the hospital in and of itself has its own risks that only increase every day. So the more that we can now treat these patients at home, the better off they are in terms of outcomes.
On average, patients are under the program's care for 3.5 days.
It's a whole new dynamic. And it's really akin to that old school house call that doctors used to do back, way back in the 1900s. Up until the 1950s and 60s, they were able to do that matching with 21st century technology.
It's just one more way Cone Health can serve its community.
We expect them to come to us, and we know they're going to come to us, but this is a way that allows us to go to them and to meet people where they are. And I think that's, Cone Health's mission, being with people and being with you.
How are you feeling?
I'm feeling all right.
Are you breathing okay?
Oh, yes.
Hospital-level care with all the comforts of home.
And if he had been in the hospital, he would have been confined to a hospital room. Here he can get up, he can move around, he can walk out on our back deck if he wants to, because it's no steps or anything. He can walk out there and get a little fresh air, and it's just a big world of difference.
And right now, the Hospital at Home program can take on up to 10 patients at any given time with qualifying conditions, including pneumonia, blood and bone infections, COPD, and congestive heart failure. It's expanding next month to Annie Penn Hospital and has approval to go to Alamance Regional once it has the staffing in place.